Hello all. Today we just will discuss regarding what is the key difference between defibrillation and cardioversion. So many of the students they have got a confusion. We are using the same equipment, but we are using two different terminology as defibrillation and cardioversion. So remember these points. So let's see what is defibrillation. Defibrillation is basically that you are going to give a current to stop an arrhythmia in a case of a cardiac arrest. And the two shockable rhythms that you need to remember is the pulseless ventricular tachycardia and ventricular fibrillation. So whenever you see these two rhythms in case of a cardiac arrest, to revert these rhythms we are using defibrillation, that we are using only in cardiac arrest. So that is what is basically defibrillation, and it is always not synchronized. So you are not going to synchronize in case of a cardiac arrest, and usually we use a higher amount of energy. So 200 joules is what is recommendation for a biphasic defibrillator. When you are not sure what is the shock, what is the energy of the shock that you need to deliver, you can use the higher amount of energy whatever is available in the defibrillator. So that is very simple. So defibrillation is the procedure where which we are trying to revert in rhythm, the two shockable rhythms, that is the pulseless ventricular tachycardia and ventricular fibrillation, and it always not synchronized, and we are using a higher amount of energy. So that is a simple defibrillation. Let's see what is cardioversion. So cardioversion is nothing much. Whenever you have got an unstable cardiac arrhythmia, so you have a unstable cardiac tachyarrhythmia, and or else you are having an stable cardiac arrhythmia which is refractory to the routine treatment measures with your pharmacotherapeutic agents, you will decide to go ahead and do a procedure called as cardioversion. So cardioversion always is synchronized. So we are synchronizing it at the peaking of the R wave to avoid the R-on-T phenomena, to avoid a life-threatening arrhythmia like a VF or a VT to develop from that. So always you remember cardioversion is a synchronized one, and you are using a lesser amount of energy in certain cases, but a higher amount of energy in certain arrhythmias. So if you have an AF, early focal atrial tachycardia and all, use a higher amount of energy, somewhere between 200 joules. So that is what is the recommendation. So when you have a lower arrhythmia like SVT, which is not getting reverted to the routine management of adenosine and all, you will decide, okay, I will go ahead and cardiovert. Or you have an unstable, you will cardiovert the patient. And cardioversion always requires sedation. So you have to give it sedation, and you are using a lower amount of energy, and it is always synchronized. For an SVT, you use a smaller amount of energy, maybe around 100 joules. For an VT, we use around 100 to 120 joules. So lesser amount of energy is only required. So you can remember like 70 for SVT, 100 for VT, and maybe 200 for your multifocal atrial tachycardia. Thank you.